there are also problems getting enough food for patients at the hospital. Some people have been dropping off donations of food at the institution. Of course, you'll know the Charlotte Macrae Hospital also not fully open after that fire last year. That, I'm presuming, adds to the load at Chris Hani Baragwanath. Professor Martin Smith is the head of general surgery at the Chris Hani Baragwanath Hospital. Professor Smith, good afternoon to you, and thank you for your time. How bad is the situation? Are there really problems with getting food for patients and workers and getting enough staff members at the hospital?
So thanks, Stephen, and good afternoon to everyone. I think that the problems that Chris Hani Baragwanath Academic Hospital is experiencing at the moment is part of an insidious process of years of neglect and years of dysfunctionality, mostly based on the fact that the appropriate budgets have never been and staff establishments have never been allocated to Chris Hani Bara. And so when you had the situation that we're currently faced with, where we're told that we can only employ 400 of 800 staff that we've been employing over the last 2 years, I think it brings us to the edge of our ability to cope. So how bad are things in the hospital? I think that at some level the commitment and the passion of the health professionals who work at the hospital keep it going. But I think they also have their limits, and they also have the point at which they can go no further. And my concern is that all of these things happening at the same time have brought many of them to that point at the same time. So is there food? Well, there is food, but for the last few weeks we haven't had bread. And so while that may have been reversed in the last couple of hours, that certainly was allowed to happen. And it's the fact that many of these problems are allowed to develop and allowed to happen. And trying to understand the root cause of where this is and why this happens, I think is where the answers lie to the dysfunctionality.
Is it true that other hospitals in Gauteng get bigger budgets than Chris Hani Baragwanath Hospital, which, as we know, is the biggest hospital in the country?
So yes, the discrepancy in budgets is definitely there. It's something that those of us who've been at the hospital for many years have been trying to correct and have advocated for over many years, is that we think that the formulas used and the tools used to calculate what the budget should be are completely wrong, and they don't reflect what goes on the ground. So there's no doubt that hospitals with smaller bed numbers and smaller burdens of patients get bigger budgets. The argument given to us is that they provide different kinds of service. But we at Barra reject that view, because we know that at Chris Hani Barra, and particularly since the fire at Charlotte, we haven't had to increase the quality or the level of care that we provide. We've just had to do more of it. And so if we were able to do more of it before, why hasn't that been recognized through the budgetary process? So I think that's where the problem is. There also staff numbers differ. Smaller hospitals have bigger staff complements. Some hospitals have many more nurses per bed than we do at Chris Hani Barra. And that has always seemed to be unfair and unjust.
You talk about issues with budget. You talk about the fact that, for example, the hospital didn't have bread. Where does the problem lie? Is it the administrators in the hospital? I know you may not want to speak badly of your bosses or your colleagues or people, even people under you who manage this, because these are people you work with on a daily basis and people who have chosen to work in the public health system. Is the problem higher? Is the problem in the Gauteng Health Department at, I don't know, Deputy Director General level or Head of Health Department level or MEC level?
So the way that purchases are done in the health department are quite complex, but the hospital has to generate an order, a purchase order, and then that gets dealt with at Gauteng Department of Health centrally. And I think that while in some hospitals the ability to generate these purchase orders sometimes is inefficient, in many of these areas that we're looking at now, like medical waste, like the provision of food, that hasn't been at hospital level. And as I understand it, the hospital is up to date with all its purchase orders and doing all the paperwork and invoicing. And that is at Gauteng Health Department level that this problem has arisen.
The fact that you have to treat patients who would normally go to Charlotte Macrae Hospital, and I mean their casualty ward, as I understand it, will only be up and running fully at the end of March. That's still, what, 2 weeks away, 3 weeks away. What impact is that having on you? You're not the closest hospital to that hospital, but you're sort of, for some people, the next biggest hospital.
Well, certainly in my area of responsibility, which includes trauma, we are the only other level 1 trauma center in this region. And so the impact on us has been huge. So Charlotte doctors have assisted us But, just having hands on deck sometimes isn't good enough when you don't have enough ICU beds and enough operating theatres and enough resuscitation bays. So the impact on us has been enormous over a period of time. It's not just about the opening of the emergency department. The fact is that not all the beds in the hospital at Charlotte Macheke will be opened. And so if the beds aren't opened, it doesn't matter how many patients, because what happens at the front room is that if the system's overloaded, they close the hospital. So I don't believe that just opening the emergency department in a few weeks' time, if that happens, and the delays have been just ongoing, and we get told it's going to happen, but it never does. This has been going on since December last year. But even if it does open, the fact that they don't have the number of beds in the hospital that they used to will mean that this continues to impact on us. And that's one of the main reasons why we are objecting to these staff cuts. Because what we've seen is that we've been understaffed for many, many years, and it's been an insidious thing. We've been arguing that point for many years. And so now still, we will be even more, understaffed, because the COVID posts, which were there to manage COVID, and as you know, the waves have fluctuated. But in between the waves, when the hospitals return to normal functioning and operating theatres have opened and we're doing elective surgery, we've come to realize how we really relied on that staff that we had. And now to go back to lose them when we know that we won't be free of the burden of the patients from Charlotte, I think makes this even more an uncomfortable decision, and one which we feel is irresponsible.
The way that this is developing, Professor, I mean, we have the pressure on you from Charlotte Macheke, we have the pressure on you from perhaps losing these posts, the pressure on the fact that the hospital just doesn't have the bread it's supposed to have. I mean, I find that amazing. Are you worried that you're going to lose more patients, more people will lose their lives as a result of these pressures, of all of these pressures? In fact, some people may have lost their lives already unnecessarily. They could have been saved.
So there's no doubt that the impact on the fire had precipitated a humanitarian crisis. I think we've again been saying that for the last year. And there's no doubt that it has resulted in loss of life, but not only loss of life, added suffering. And so you're absolutely right. It will continue to do so. And I think that communities need to know that. I mean, we know about oncology. There's been a lot of public information around the lack of oncology care. And those patients have died. There's no question that patients have died from the lack of access to some of that treatment.
Professor, thank you very much indeed. I really appreciate the time. Professor Martin Smith is Head of General Surgery at the Chris Hani Baragwanath Hospital in Soweto.